I do sense that there's a complacency now that we've talked about easing of lockdown, that somehow it's all over, and it certainly isn't. We don't want a second peak, because a second peak could be even worse than the first one.
You must stay at home.
Whatever it takes.
We will beat the coronavirus, and we will beat it together.
So as we know, the government has laid out their roadmap to how we end the draconian regulations of lockdown, but it's all dependent on something called the R rate, the rate of infection. But what exactly does that mean, and how critical is it that we keep it below 1 if we want to have a normal life? So Dr Hilary Jones is here, Britain's most trusted medic. Dr Hilary, the R rate, where are we at with it? What does it mean?
It's the reproduction rate and the reinfection rate of coronavirus. So basically, it is the number of people infected by the first person, if you like. So one person gives it to one other person, the R rate is 1. If we transmit the virus to less than one other person, it becomes less than 1. And currently it is thought that the R rate in the UK is somewhere between 0.5 and 0.9 during lockdown. And the critical thing is that after lockdown, when we start to ease the restrictions, we must not allow the R rate to become more than 1. Otherwise, we'll see more cases and we'll see more mortality again, and the NHS again having more work to do. So the R rate is all critical. If we can keep it low and make it lower as time goes on, then we will eradicate the virus eventually, even before we have a vaccine. But that will be difficult to do because this virus is very transmissible.
And given all of the changes, you know, things like, for example, more people being encouraged to go back to work, things like public transport being more crowded than they have been during the draconian lockdown, things like being able to sit in the park with one of your mates who is in your household. How do you think that will impact the R rate, and could it push it above 1 again, Dr Hilary?
Well, of course it could, and we still need to be very disciplined about how we behave between one another. So public transport's a worry because it's very difficult to socially distance if you're on a crowded bus or a train. It's very difficult in care homes to keep the transmission rate below an R of 1. And we will just have to monitor very carefully what's going on. We're going to know in the next week or two how effective the easing of restrictions is in controlling the R rate. It's absolutely critical. We're seeing more cases already in Korea, in Germany, and in other parts of the world where lockdown has been eased. And they've perhaps gone a step too far, opening bars and restaurants or allowing people out in public too quickly. So we've got the advantage of being able to copy what other countries are doing, but we will need to be extra vigilant because I do sense that there's a complacency now that we've talked about easing of lockdown and we've had the announcement yesterday by the Prime Minister that somehow it's all over, and it certainly isn't. We don't want a second peak because a second peak could be even worse than the first one.
Now let's get to your questions on the hashtag Ask Dr Hilary. The first from Michelle Staples today. She says, I work as a domestic cleaner in private houses as part of a team of 2 to 3 people. We usually travel in one vehicle. Should we be travelling alone when we get back to work? And should we have face masks for when we are in the houses? Some homeowners are at home when we visit and some houses are empty.
Well, my first thought would be that you shouldn't be travelling in the same car. If you're in different households, the possibility of viral transmission is quite high. In a car, you've got a small space, air which is recirculated, and the possibility for transmission, as I say, is high. So you should all be travelling separately. Whether you should be cleaning at all is a moot point. You're going into different households. There's the potential to transmit the virus through what's on your cleaning materials, what's on your bottles, your things that you use, your products, on your hands, on your clothing. And as regards face masks, I think if you're socially distancing, when you get into somebody's home, the use of a mask is probably, there's little evidence that it's going to be very effective. That's my personal view. Others might differ. but you shouldn't be getting anywhere near anybody else in that house. Preferably, they're not actually there.
And we've been sent this from Ross Hammond.
Hi, Dr Hilary. I'm a male primary school teacher and I've been working throughout this pandemic with the children of key workers. I wanted to know, are male primary school teachers, or indeed male school teachers in general, more at risk of contracting the virus from children? And when schools fully reopen, what precautions should we take? Social distancing is incredibly difficult with children below the ages of 11 years old, and I've known that throughout the past weeks. But although we know children are not adversely affected by the virus, should we be concerned about them potentially transmitting the virus to us when we're in a closed classroom space? Thank you.
Well, teachers, we know, doing an incredibly good job, and they've never been more appreciated than they are right now with parents trying to homeschool their children. Now, it's true that if you look at the more severely affected cases in hospitals, they tend to be male. But the male gender itself, we don't know how much that is a factor. It could be that male hormones are predisposed to severe disease. It could be that males have an increased tendency to obesity, to diabetes, whatever. So we need to look at that. But I wouldn't say that a male teacher who is young and fit generally has a greater risk of contracting the virus or suffering from the virus than a female colleague. But I do understand it's difficult to socially distance children from one another, and for teachers to socially distance from their charges in the school. So I think that it is important to socially distance, to keep the class numbers small. And maybe it'll be necessary to stagger the year groups that come into school each day of the week. But they will need to be socially distanced to some extent, as much as possible. And of course, they're looking at different age groups coming back before others. So I don't think as a male teacher you need to worry excessively. But we are looking at the epidemiology all the time of this coronavirus, and hopefully we'll be able to show that you're not at any greater risk than your female counterparts.
Thank you so much for your question, Ross. Thank you, as ever, to Britain's most trusted medic, Dr Hilary Jones. And Hills will be back answering more of your questions tomorrow. So all you need to do, if you want to send any question in, nothing is too stupid, use the hashtag Ask Dr Hilary on social media, or you can go to thesun.co.uk/Dr Hilary, or visit talkradio.co.uk. And we're back tomorrow with another edition of Ask Dr Hilary, Coronavirus Explained. Thank you for your company. Thank you, Hilary.
Thanks, Dan. Take care now.